Hello, I'm here with Dr. Kirby Bunel of OMS of Northeast Texas, and we are going to talk to him today about everything going on and how he is adjusting his business. So, Dr. Bunel, can you tell us just a little bit about yourself?
Sure. Thanks, Cassie. I'm Kirby Bunel. I'm the senior partner at OMS of Northeast Texas here in Texarkana. Been in practice for 27 years now, believe it or not. We have 5 oral surgeons in our practice, and we perform conventional oral and maxillofacial surgery in our office, as well as major surgery in the hospital, trauma, and those kind of things. Our special expertise is in dental implant reconstruction. Together, we've probably performed 10 or 12,000 dental implants over the years. So we've had lots of practice doing that, and that's a very big part of our practice nowadays. Although currently, with the COVID pandemic, we're open to see emergencies and urgent problems dental patients are having, consistent with Governor Abbott's order from March 22nd, when he asked all dental practices to stop treating elective or performing elective treatments and doing emergencies only. And many of our colleagues have closed their office altogether or working very few hours. So our charge is to take care of these dental emergencies and toothaches and things, so people aren't going to the ER.
Yes, sir. I know that you kind of adapt with only being open for like dental emergency. Is there anything else that you guys have done to adapt to the sudden change that you guys are experiencing?
Well, yes. We not only our schedule has changed, as we mentioned, the type of patients we're seeing, but a couple of things we've done internally, our operations. We have a big staff, so we've divided our staff up into 2 teams, and half our staff works 2 days a week, and the other half works the other 2 days a week. And we divide our doctors up into similar teams. And our reasons for doing that are twofold. One is we have less patient volume than normal, so we're not in need of everyone here every day. But most importantly, it divides us up into 2 teams. So if someone were to have an exposure and have to be quarantined, then we don't expose the entire staff. So another team would be available to continue operations. That's one of the major operational things we've changed. In addition to how we screen our patients, the CDC has recommended questions we're asking patients about their travel history and their potential exposure to other patients, and whether they have a fever and those types of things. We're taking their temperature. We're also recording the temperature of each staff member every day. So if someone shows a trend there, we can take action with that information. And then there's an antiviral mouth rinse we're using to help reduce potential viral exposure as we're working in people's mouths, of course. We've been using infectious disease precautions for 25 years, so we don't perceive this to be a dangerous place to be, but we're trying to make things as safe as possible. The other operational change we've done is we've not letting people sit out in our waiting room. So the patient will come in and check in, then go back out to the car. We'll call them on their cell phone when they're ready for treatment. And then the family member is just being met outside as we discharge the patient, rather than bringing extra people into the office. So we're trying to limit patient-to-patient exposure and use the social distancing recommendations that are out there now. So that's kind of the biggest changes we've made. That we're trying to keep our employees working.
Yes, sir. And how has it impacted like your industry overall? Do you have any information on that? I know it's had a tremendous impact on the day-to-day.
Yeah, there's like many professional groups. One place I look is there's a Facebook group for dental personnel, and of course in the larger metropolitan areas like Houston, for example, Dallas, people are very, very worried because they can't work. That's one worry. And then the other worry is, you know, PPE, protective equipment that people are needing, not having access to, like the N95 mask, are kind of hard to come by for dental professionals right now. So I think just the biggest issue I see in dentistry right now is just all the staff are worried about their employment. The dental office is closed. There are a lot of dentists who are themselves employees that some of these corporate chains are now furloughed. There's just a lot of unemployed people in dentistry. I think the thing I want our patients to know is that, our shutdown really has more to do with supply chain than it is danger. Our dental office is very safe to be treated in. I mean, it's always kept clean and disinfected, but especially so now. But the governor doesn't want us consuming all the PPE supplies that might be needed in the hospital setting. And so the fact that we're not working gets us concerned about the ongoing dental emergencies are going. That's kind of what we're trying to help with. But that's the biggest change, is people just aren't working and they're worried about that. But going forward, when we resume working, will there be a significant change in how we treat patients for this presumed new threat? I was speaking with someone the other day. I came up in dental school in the 80s when HIV first came on the scene. And you might be appalled or surprised to know that when I started dental school, using latex gloves in the dental clinic was not required.
Wow.
It was only optional because many dentists did not wear gloves to do routine dentistry. We did it in the oral surgery department to remove teeth, but you just had a filling done. Nobody wore gloves. But when the HIV issue came up, that's when it became mandatory to wear latex gloves in the dental clinic at the school. So my point of saying that is we've been using infection control procedures forever, but will this new airborne virus create a new paradigm in the way we do things? No one really knows the answer to that right now.
That's very interesting. I cannot believe that there was a time that they did not use gloves and they were inside your mouth. That's kind of crazy. It's kind of like, I can't believe people used to smoke on airplanes. I'm like,
yeah, I remember that. Yeah. And the phone was connected to the wall.
Yes. My kids
will
know nothing about that.
Yeah. I was the first dental school class to hit the clinic where wearing of gloves was required rather than option.
Wow.
So I always came up wearing gloves, but the older dentists really complained for a long time because they think they lost their tactile sensation in their fingers to do more finer things. Of course, that all was for naught because we all wear gloves now. But yeah. A lot of young people can't even fathom that.
I can't. That's crazy. But I'm glad it did evolve to that. So maybe, there'll be something good from this as well that you can reflect back on one day. What is something that is there anything the community can do to help you guys during this time?
Great. I think, again, there's a couple of sort of broad areas I would address. Firstly, if you've got a questionable tooth, don't blow it off and end up in the emergency department. Okay, establish a relationship with a dentist or come see us. The last place you want to be anytime with a dental problem is the ER, but especially today, we don't want you consuming valuable resources in the emergency department that are needed for other patients, both in personnel, financial resources, and PPE that's getting all the press now. So that's why the governor has charged dentists to remain open and treat dental emergencies, so we don't have people going to the emergency room. So it's really an inappropriate place to go for dental emergency at any point. Not to say that you won't get help there. You certainly will get some medication and referral, but your dental problem is cannot be solved in the hospital emergency room. So don't go there. Come see us. We'll take care of it, keep you out of the ER. And secondly, don't be afraid. I mean, I think everyone should be cautious and use good sense, but don't be afraid. It's a safe place to be. We can take care of you very safely. And when the world opens back up again, we'll be here to resume our more normal course of treatment, and come see us. We have a stack of charts of people waiting for treatment that had to be postponed because of this situation. So myself, our practice, all the dentists in town will be anxious to get back to work and know that it'll be safe to do so.
Yes, sir. Can you give us your phone number where people can call if they have a dental emergency? What
Sure.
number do you need
It's
to call?
area code 903, of course, 794-3331.
And then also your website is available
Yeah, it's a
for
long
people
one,
to
but it's
chat.
easy if you just think about it. It's www.omsnortheast, that's Northeast Texas.com.
And y'all,
I would choose as a favorite so you don't have to type that out every time.
yes, and I saw that you have where people can chat as well. If they go to your website, they can immediately start chatting with
Yeah,
you.
that's a service we subscribe to, so a live operator can answer questions, and then what they do then is call our office and connect the caller to our office staff. That's how that works. Yeah.
So you guys are available all the time, and I'm glad to know that y'all are safe and available and can help people, and I appreciate your time.
Thank you, Cassie. I enjoyed our talk.
Yes, sir.